to go to the ER, but the patient has to be seen. So then the urgent care concept comes into the picture.
This would be an urgent care.
Yeah, not necessarily providing that service on the phone, but they should be able to go to an urgent care. It was part of our proposal to Medicaid, where we have so many primary care physicians in the system. So because of that, we should be able to have enough volume to support an urgent care concept for our patients, if it's necessary, and if we have enough. If we have enough manpower, of course. But I think that completing that, not necessarily, I don't believe, I agree with that. I don't think you're going to have someone to come for a physical at 11 p.m. at night. But what can happen after that, triaging the patient, if they need to be seen sooner, then they can just go to the outpatient clinic for the urgent care.
Other than that, I had written, I do like the idea of having part-time students from vocational type high schools, and even colleges. I just said to Kemal that, Goldey-Beacom and other schools that are creating healthcare majors for the first time should really probably require all of their students to do like an internship as credit. I mean, of course, instead of taking a class, you would do an internship, or it would be like a co-op in the doctor's office or in some sort of medical environment, because you'll learn so much more than you learn in some classes. But other than that, it was good. I'm not sure that Dewey Beach, Delaware needs a full 9 provider office, but
well, if you think about where, especially, I will say Dewey Beach, think about the summertime. Think about the other. You have Bethany, you have Fenwick, you have all your beach surroundings.
I'm a Dewey Beach. So,
if you think about that, in the summertime, you're going to be overwhelmed.
300 to 30,000.
Travel from Dewey Beach back up to Wilmington,
right?
On Sunday.
Trust me, I've been to the Levy Medical Center down there in Bethany.
Really? I know.
And the concept of waiting 3 hours to get 600 taken out is not bad.
Well, so what do you guys think about your presentation?
I thought it was pretty great. It was awesome.
Pretty great?
It was awesome. Pretty good. Pretty awesome.
Huh?
I thought you guys did a great job. It was very informative. And I like that you guys, but my question is, what happened to guys? Do you not consider male? Like, cause, well, it's all about, it's a women's clinic, but there's nothing for, there's elderly clinic, there's clinic for babies and all that stuff, so I'm like, but they didn't really mention anything about guys.
Well, the overhead of a male's treatment usually goes to their internist. A woman requires separate, a little more special care.
More complex.
So,
plus I think we had kicked around the idea of adding more doctors to it, but then it turned into like, you could be here all day, added urologist, oncology, all that kind of stuff to it. So we tried to just keep it to some of the main community issues. But yeah, I agree with you. These guys need to get checked out too. Statistically, they don't do that.
I mean, look at Kemal. He was talking to me, asking him to have a surgery. Somebody needs to call him and remind him.
What did you guys think about their presentation?
It's true.
it was very good. It was very informational. I like the idea of having the cancer treatments and what the different cancers represent, and understanding those types of services.
Maybe we can partner up.
I can refer my cervical cancer patients.
From in your opinion, what would you do differently if, after seeing their presentation, what would you change in your presentation?
Why is everybody looking at me?
They're looking at you, so I have to look at you.
After seeing theirs, I think we should have included like more. I thought we gave more of the meat, but not explain like what the meat means or how to we didn't really break it down like we're supposed to. So we should have like included more slides, like explaining things more.
It was long enough.
Yeah, like,
50 slides. I was like, alright, we're done.
But saw how they broke down everything real simple. Like this is the women's clinic. This is what they do. This is the numbers. This is all this stuff. Like we should have done something like that. I like the flow of it.
I just felt like I wanted to stay away more from the financial part because that's what we did in like the first class. So.
You could have dug out those old things and
How
stuck
about you
it.
guys? What would you do differently?
I think we could have added more numbers, like you guys were all bringing up, showing the difference between why we think that our group was not better, but the need for it, and the cost difference between the ER and our offices. That I think we could have brought that maybe more to it.
Right, well, I think you guys did great. It was a very good presentation. Like as Alicia said, I think you explained the studies, the pilot program, the different elements very well. So someone who doesn't know versus from someone who doesn't know anything about it to someone who's in this specialty. It was very brief, but it was very informative. So the numbers, I think you did good numbers. The only thing that I didn't see is again, at some point at the end you have to have, okay, this is how much we did with these studies, this is how much it cost us, and this is how much we save for the insurance company, therefore, or perhaps this is a pilot project, so we don't know if it's going to be successful. Perhaps it didn't work out, so therefore you are not going to do it. So, but I enjoyed it a lot. All right, I think that's all we have.